Well, the NHS has launched a new campaign to raise awareness for pregnant women to get vaccines against COVID-19 and flu this winter. And to discuss this, we've got GP and media medic Helen Lawal on the line. How are you doing today?
I'm good, thank you. I'm very well.
Great. So why is it so important for pregnant women to get vaccines this winter time?
I mean, it's always important for pregnant women to have their flu vaccination, but perhaps more so this year, as we're seeing lots of people have little immunity to the flu because it's not been circulating for the past couple of years. But in addition to that, we're also considering the COVID-19 vaccination. And we know that we tend, from previous years, we tend to see COVID-19 and viruses in general peak around winter time. And so now really is the time, if pregnant women have had some vaccinations in the past, to get an autumn booster, or if they're unvaccinated, to really consider having that first one to protect both themselves and their baby.
And what can you say to reassure pregnant women? Because some, maybe understandably, might feel a bit concerned that it's not safe while pregnant.
Yeah, I can see why, because in the early days of the pandemic, we didn't really have the data. At first, we couldn't really safely say to women, you can have the vaccination, but we do now have that data. And actually, a recent study has shown, looking at over 3,500 women who were pregnant who were admitted to hospitals, for those who had a positive COVID test, and it has shown that we know these women are 2 to 3 times more likely to give birth to their baby prematurely if they do have COVID-19. But that reassuringly, if they've had up to 3 doses of the vaccine, actually none of the women ended up being admitted to ICU with severe COVID-19. So we know, although there's a risk for these women, the risk is reduced greatly by having the vaccine.
And it's interesting because the latest evidence shows that vaccination has reduced the risk of stillbirth by 15%, which is really interesting. Is that because COVID itself can cause stillbirth, or is it some other weird reason?
Yeah, I mean, this is a very nice topic for women who are listening, who are pregnant, to have to think about this. So I do sympathise with them, and we just want to give them, the information they have to make the best decisions. But we do know that having COVID-19 vaccination does increase the risk of giving birth prematurely. And we know that by having the vaccination, yes, it can provide them with that protection to reduce the risk of, harm coming to the baby, including stillbirth.
Yeah. Maybe some women might, they're still worried about side effects and whatever, and maybe it's only a matter of a few months or a few weeks even until they won't be pregnant anymore, so they might as well just put it off until then.
Yeah, that could be one perspective and one point of view. And what I would say is, if it's possible to reframe that perspective, is that this isn't just about protecting you, it's about protecting your baby. And we know that for women who are pregnant, who are able to have the vaccination, this will give the baby protection from COVID-19 for up to 6 months after they're born. And so therefore reducing the risk of baby needing hospital treatment themselves for severe COVID-19 related illness. So yes, even if you've just got a few months left, it's still worth having to protect your newborn.
And flu as well, is that more important than ever, maybe? Because as you mentioned at the start, it's kind of been, I don't want to say dormant, but it's been less present than previous years recently because we've been locked down and things like that.
Yeah, potentially it is more important than ever, the flu jab, to have your annual flu jab if you're in a high risk group or pregnant. And the UK Health Security Agency has, shown us that the flu rates from October were going up really quickly, and the suspicion is that there is reduced immunity in the population. So more relevant than ever to have that as a pregnant woman. And it's absolutely safe to have both of them together or very close together on the same day or within the same week. And they're both, of course, are not live vaccinations. And the risk, of course, outweighs the benefits of any mild side effects.
And do you just get the vaccine in kind of the normal way you would get it if you weren't pregnant? What I mean is you just get get the appointment, it wouldn't be done when you're going to the doctor anyway for pregnancy appointments and all that.
Yeah, good point. And potentially it would be different, and this is going to vary depending on what region you're in and things. But in theory, you may have access to it through your GP in the usual way, and also through your maternity services. So whether that be through the midwife, and often midwives are based within GP surgeries, but some women who have underlying health conditions may be going to the hospital to see their midwives and not obstetricians. So please do ask them, because if they can't give it to you, they will tell you how you can get it as quickly as possible. And also some local pharmacists as well will be offering that. So please do ask, but be proactive about it. Don't necessarily wait to be offered an ask. Yes, you should be offered it, but you don't need to wait, and it is safe to have it in the very early stages of pregnancy, so you don't need to wait to see a midwife.
Well, where can we go to find out more information?
So the usual NHS website, nhs.uk/winter vaccinations, or as I say, do speak to your midwife or GP.
Excellent. Well, many thanks for talking to us today. It's been great to have you on.
Thanks for having me.